Farmington. KSJE is supported by San Juan Regional Medical Center, your community hospital with a rich heritage that dates back to before New Mexico was a state. We've been improving the health of the Four Corners since 1910. As a nonprofit hospital, San Juan Regional Medical Center is a values-driven organization. We strive to deliver on our mission to personalize health care and create vitality and enthusiasm in healing. We are here for you when you need us, offering a comprehensive range of inpatient, outpatient, and emergency care services. (8:34) KSJE. You're listening to the Scott Michlin Morning Program. Good morning, everybody, and thank you for tuning in this morning. Welcome to our viewers who are joining us on the KSJE Facebook page and YouTube channel. Taking a look there outside at San Juan College at the sunrise. It is 35 degrees outside our studios this morning. Winds are out of the east-northeast at 4 miles per hour, and our weather forecast calls for a mostly sunny day on this Friday. 60 degrees for a high today, clear tonight with a low of 38. A windy day tomorrow with sunshine. Saturday's high 58 with wind. Windy overnight on Saturday with a low near 30, and then partly sunny skies on Sunday. Chance of a shower developing overnight, Sunday low 39. Partly sunny skies on Monday and mid-50s for a high all next week. I'm Scott Michlin. My guest on the radio this morning, Rick Quevedo, is here. He is the director of Desert View Family Counseling here in Farmington. We are talking about mental health. And again, Rick, thanks for being here.
Thanks for having me.
You bet. Appreciate you coming in to talk about this important topic with our community and what it has been through in the last almost 12 months now, and what people go through every day, I think, just by being part of life.
Yeah, I'm glad you mentioned that, because I think that when tragedy or trauma or tragedy happens, we really recognize all this. But you're right, people struggle with this every day.
Right.
Every day.
And so we want to, again, open up the program to a conversation and have folks join us if you have a question about mental health, maybe someone you know, or have some ideas or something that you have actually gone through and come out on the other side of. We'd love to talk about that as well with you. You can give us a call here at 566-3909, 566-390.9 at KSJE. You can also write a comment on the video we are streaming on the KSJE Facebook page, and we will see it here. And we can I can relate it to our guest, Rick Quevedo, talking about these different types of things. And we mentioned certainly the incident at Aztec High School, but I think any time these days a school goes into lockdown. We had an incident here yesterday at San Juan College, for heaven's sake, with a suspicious package, and a building was evacuated. And I know there were a lot of anxious moments from folks that just, if they have students or spouses that come here wondering what's going on.
Yeah, and mostly adults go here, compared to like students in the schools.
Right.
So, yeah.
But
kind of scary.
Lots of anxiety, I guess, and that can be another mental health situation, correct?
Yeah, correct. Yeah.
And so with that being said, what could folks be watching for? And again, if I'm a child with a mental health issue, is that different from an adult with a mental health issue?
Not too much. Not too much. Adults tend to stay a little busier because they work and they've got to function and take care of their kids and stuff like that. But again, just watching for symptoms of being withdrawn, changes in appetite, changes in sleeping habits, kind of withdrawing from friends or family, not really engaging in any kind of conversations, just kind of going to a dark place, I guess. And sometimes people just like to kind of lock up in their room and draw the shades, and and that's how they're recovering, so to speak. Right,
exactly. This toolkit that you brought with you this morning, the Recognizing Anxiety, again, has some statistics. About 31.9% of young people have an anxiety disorder.
Yeah. And
what would that look like, I guess, to the rest of us?
It could be a bunch of different things, but mostly it's just feeling nervous, just kind of...
Nervous in social situations, or just nervous everywhere?
In general, some people are just excessive worriers and stressors, and it could be social anxiety. When I was growing up, dealing with anxiety, there wasn't a name for it back then, and we certainly didn't talk about it back then.
Right.
And so in my 20s, when I couldn't be in crowds or grocery stores, and I didn't understand that, knowing now it's agoraphobia,
Right.
Yeah. So it's come a long way.
Now we know information, right? But that is something to for parents or teachers or anyone to really recognize that in a young person, right? And tell them that there is help and they're not alone. There's other people that suffer from the same type of thing, I'm sure.
Yeah, and some people are, including children, are open to therapy, open to talking to somebody right away, and sometimes not. And that's okay. I think it's important as a parent or a friend or whoever that person is to just make that person feel comfortable, to keep chipping away at that conversation and try to normalize that conversation as much as possible. Because, like I said, some people aren't ready to go talk to a therapist.
Right.
And the whole thought of that pushes them back even further. So
you've got to be sensitive to that too.
Mindful of that, yeah.
Yeah, exactly. Other things, some of the types of anxiety disorders, generalized anxiety, phobias are listed, and things like that all can, again, be part of this condition.
Yeah, correct, yeah.
Right.
Nervousness and difficult relaxing, sleeping, just the constant mind going.
Right.
Yeah.
Panic disorders, social anxiety, as you mentioned, things like that. So again, things along these, and for people to know that maybe that's not abnormal, or other people suffer from the same thing, and that maybe helps them to know that they're not alone.
Yeah,
going through this alone.
The numbers are there that certainly there's a lot of people that deal with this, but it is scary, especially when you don't understand it, especially as a young person.
Right.
What is wrong with me? Why am I different? What's happening to me? Adults, we can reach out and ask those questions or have those conversations a little bit easier, but not for young people.
Exactly. That's very, very true. And so again, the advice would be to just have that conversation with a child. Tell them that
make time with your child. Just stay plugged in and have those conversations. And I think it's okay to share experiences with your kids too, of your own experiences. That kind of, again, normalizes it a little bit to make them feel a little bit more comfortable about sharing what they're going through.
Right, right. Very good. Rick Quevedo is my guest this morning. Again, if you want to join the conversation, we invite you to do that. You can make a comment on our Facebook page during our streaming video here at KSJE. You can also give us a call. 505-566-3909 is the number. 505-566-3909. You can give us a call and join the conversation. But what else do we want to share? What else is important that folks know about mental health as we've been talking this morning?
Well, we've been talking about your new system here and all that stuff, and I was just going to kind of share that, Desert View is certainly on the same page. Originally, we had set up on our webpage where people can message us in, send us a message, and then we took it to the next step, and now we've got Facebook Messenger that's secure, that young people have been messaging into.
Right.
And so, they're not ready to call or have a face-to-face, but we certainly can answer their questions and possibly give them some techniques that way. We're working with somebody about doing some PSAs and more live Facebook videos. Not me, but somebody that's, that's really going to get this message across. And I think it's important because things are changing so much,
Well, that is something we've talked about, too, is that there is still maybe a stigma attached to mental health, and reaching out. It can be a real tough first step to take to talk to someone. You have a radio program asking folks to call in or write a comment, and that can be really difficult for folks to even admit that they either think they have an issue or have a question about it, or maybe know someone, and how publicly do you want to be about these types of conversations? So I can understand why folks maybe aren't tapping away and clogging up the phones this morning, and that makes sense. But hopefully the information that we're sharing is important to them, and they can take that next step and do make a private phone call to a counselor or get some information to their teenager or young person, because this is really an important topic to have.
It is, and the important thing is the resources are there. And before, I don't know that they were there that much, or people knew about it, but we're really trying to, make sure everybody knows it's okay to reach out. It's okay to have these conversations.
Many times folks might think, I live in Farmington, or I live in Aztec or Bloomfield, and we're such a small town, we don't have access to these types of resources. I just have to suffer in silence, I guess. It's just me that's having this problem, and that's not the case.
That's not the case. And I tell you, I've got folks that I know personally who've called Desert View, and I'll refer them to somebody else that, make them feel comfortable type thing.
Right.
But like I said, the help is there.
Sure.
There's lots of community agencies. There's lots of small private practice folks that we refer to as well. So the help is there.
And again, if it's an older person maybe who was like, well, when my parents went through this 20 years ago, it didn't work out very well, or they seem to be worse off, or what have you. But I imagine that the advances in understanding mental health have really advanced in the last 20 years and keep advancing, right? I mean, with the medical and what we know about the human mind and brain.
Yeah, and definitely more techniques to work with both the kids and adults. And, I hear that a lot. People share negative experiences about therapy back when, but this is about you, the individual, not a past experience with a family member or their circumstance, but just kind of digging and finding, where you need to be.
Sure.
Yeah.
But it may take some time too. And I think sometimes in our society today, we want a pill and boom, in half an hour, I'll feel better and everything get back to normal, whatever normal is.
Yeah.
And that doesn't always happen, right? This is an ongoing therapy, ongoing thing that folks need to be aware of and work towards the solution, I suppose.
It takes a while. And you got to be ready. And, we discussed earlier that sometimes treatment can be short-term. Sometimes it can be a lifelong experience.
Right.
It just depends.
And that would be maybe learning about what triggers or what bothers you or what causes anxiety or depression, or learning about that about yourself, I suppose, to be able to deal with it.
Yeah, I think that's one of the things that we definitely work with our clients on is you kind of have to make friends with that other side of you, so to speak. It's part of you. It's who you are. And so when you can kind of accept that and that piece of your life and you can kind of work together, it sure does make things a lot easier to work through. So
very true. Yeah, that's true. Other things we want to pass along to our listeners this morning. This is another area that we're talking about. Depression is another one,
huge.
Right?
Yeah. I'll let you read that because I can't read that far.
I'm sorry. Throw it on the screen here. That's okay. 3.1 million young people ages 12 to 17 deal with a period of depression, I think is what it is saying to us. Yeah. And 78% of young people ages 11 to 17 who took MHA's depression screen recorded positive for moderate to severe depression. That's some kind of a test, I suppose,
yeah,
right?
We use several different screenings to kind of find out. And this is even more complex than this because a lot of people self-medicate, through drugs, through marijuana, through alcohol. So that makes the problem even more complex.
Yeah. Let's talk about that for just a minute because, again, if you've got an issue, right, and you are self-medicating and that just either exacerbates maybe some of the symptoms or makes you feel you may think you're feeling better but you're really feeling worse, I suppose.
It does both.
Yeah.
It does both. But the second part of that is that it even removes you more from the situation and the seriousness of it.
Right.
And that's a lot of times where people really get into trouble with addiction and overdose and such. So.
And that seems to be a downward spiral.
Yeah.
In many cases, right?
Yes.
And that's even harder to get out of.
Definitely.
When we're talking about trying to get back in to be a productive part of society. Because I know people can have really crushing depression and really not feel like they want to do anything, go to work or deal with the family or deal with the kids or whatever it might be. And that is something that can be dealt with if you're aware of it.
Yeah. You just got to want to be there to help me, Scott. Got to be ready to do it.
That's right.
Yeah.
But that's that other side of you that you're talking about, right? Is to kind of be ready to identify what that is and where to, and how to seek help.
Yeah.
And again, that first step has got to be a really big one for a lot of folks.
And change happens when we allow it, and that is so hard because sometimes we're not ready to let go. Even if we're in the worst situation, we're miserable, we're dealing with the depression, we're dealing with addiction, whatever those things are. If we're not ready to let go of that yet, nothing's going to change.
Right. Very true. Let me ask you again about, we've got a few minutes remaining this morning, folks maybe, again, who talk a little bit about, well, back in my day or when I was growing up, we just dealt with it and we didn't need all this extra help. We were able to deal with it in the family and no one else needs to know about this. If you've got a problem, that can't be good.
No, it can be good. And I think that's how some of this stuff becomes generational as far as, it's almost like carrying that sickness over generation to generation.
Right.
And so, no, that's not good. And you're familiar with some of our other programs that we do, including the truancy court. And that was the biggest reason we got into the schools is to help the schools and parents and students understand that there are other reasons that the child does not want to be at school or can pass a test or be social. And that's because of the things that we're talking about this morning. And if they can get those things under control, they can definitely be a more effective student.
Sure. And that brings up another point that some other symptoms, I guess, could be like if a kid is ditching school, that may be a symptom of another more mental health problem, not just that they don't want to be in school and they just want to go out and be naughty.
They're being naughty and they don't want to be in school, but it could be that they just physically and emotionally can't be there in that setting, trying to focus on the material, trying to be around people, just can't do it.
Right.
Yeah.
And they're usually reasons why, whatever that might be.
Right.
This anxiety or bullying or what have you.
Yeah. Yeah, and when you have any of those things, depression or anxiety, and then any of these other things happen, that just, makes it even worse. Definitely.
Right. So again, in the minutes we have remaining, Rick Quevedo, this morning, I want to go back to kind of the reason that you're here, and we wanted to talk about this at this time, is because of this very big incident in Aztec, and the anniversary will be coming up in December, which is now just a little over a month away.
Coming up.
And and I expect the media will probably do some stories on it, coverage. The 1 year anniversary, the media loves to do anniversary stories.
Right.
I remember,
Right.
and I know,
Right.
And that's okay. I mean, it's they have the right to do that. But for a lot of folks in that community, it could reopen some really tough wounds that folks maybe thought that they'd gotten away from in the last 12 months, and here we go again.
Yeah,
right.
And we've already reached out to the paper. We work with somebody particularly with our articles, and I just love that he's getting it. The
Right.
education part of this and the sensitivity of this, and so we're going to try to do something kind of like we're doing as far as just the help part of it, letting people know that we're there,
Sure,
and being a resource.
right.
So.
But and that's a great example. But unfortunately, we've seen the influx, and probably, and no offense, out of town media,
Yeah.
but
Right.
I imagine out of town media is going to come back to town and maybe do some stories, and they may not have the same sensitivities or even the same reason to maybe want to talk with people like you and to maybe understand what the community is going through, and they may not be quite so understanding.
Sensitive, yeah. No, I agree with that. And I think that goes back to the importance, again, of parents, making that time for their kids, having those conversations, find out what your kids' is, I don't want to say deficits, but, what the things that make them sensitive to this situation. So you can help prepare. There's all kinds of coping mechanisms, coping tools online,
right.
That you can help use for your kids to prepare them for these days to come.
Good advice. And again, there is some information about trauma that we could talk about too on this website that you brought in, understanding what trauma is, from being bullied to losing a loved one, living through a disaster or a traumatic event, which is what we're talking about a little bit, not feeling safe at home, being abused, seeing something violent, again, another direct relationship to what we're talking about, not feeling safe in the neighborhood, or being exposed to something bad that happened to a loved one. All these things.
Yeah, and I think we forget that. There's many kids that have grown up that have lost a parent to a tragedy, or just losing a parent is pretty tragic.
Sure.
And then these kids that are physically neglected as well as abused.
That's true.
Yeah.
And again, and even I guess something as commonplace as a divorce could be traumatic for children, right?
Yeah, very
if
traumatic.
All of a sudden mom and dad are living apart, or the kids are going back and forth.
Yeah.
That's upheaval of all different types.
Just shattered their world, what they knew to be their norm.
Right.
Yeah.
But that could be part of this as well.
Absolutely.
And certainly. So again, if folks are, I guess, understanding where we're coming from this morning, it is just that this is coming. Folks who may thought that they had put this behind them and have moved on may find that some things get reopened, I guess.
There's positive ways to deal with this, and that's how we grow as humans, and that's how we heal. And like I said, I think Aztec's being very proactive about what's coming up, and we're just glad to be able to be a resource in the community as well.
Right. Here's a question from Facebook. Known support groups for teens or adults with depression or anxiety. Any known support groups in the county, Rick?
There's not a whole lot of them, unfortunately.
Okay, but there are some.
Last I heard there was one at the hospital, but I know it's been a little while.
Okay.
And here's the challenge with that is the numbers. People sign up for them and they don't show.
Ah, right.
And so it's really
how often do you have a group with one person?
But we'd love to offer that, and we have tried several years.
Okay.
Yeah.
So there you go. There's the answer. But thank you for the question, by the way, and that's why we're here to answer questions. So appreciate that very much.
You might have started something with that whole question thing.
Well, I hope we would. And again, if folks maybe meant to ask or still have a question, I'm sure they can reach out to you through your Facebook page or email.
Facebook page. My email is rick@mydesertview.org. You can go to our Desert View Facebook page, our website, and there's a message site that you can actually send a message that goes directly to me as well.
Okay.
Yeah.
And I know, because again, as we mentioned, it is a sensitive topic, and I know folks are cautious about talking about it even in this day and age, and we still think we've made giant steps, but there's still steps to take.
Yeah, and I think the last thing I'd say is to us adults, take care of yourselves so we can take care of our babies, It really starts with us.
Right.
Yeah.
Well, and again, it goes back to those first responders. So I know took advantage of the services that were made available to them, who responded to Aztec.
They sure did.
And they deal with traumatic things each and every day, for heaven's sakes. But I mean, it.
Yeah, for us to go in and work with them, it was very humbling because, like you said, they see all kinds of stuff daily as well.
Right.
So.
And again, but I know when it hits your community and people it's even more difficult maybe to see that happen to people in places that you care about.
Yeah, we recently presented at the Homeland Security Conference in Albuquerque back in August, and they spent 3 days on this, and it was just really hard still to hear all this unfold, even though I know the outcome and,
Right.
Yeah, all that.
That's true.
So.
And, we hope it never happens again, but we think that it's always a possibility, and so again, knowing how to deal with that, I think, is a way to move forward, but still honoring those who were lost and what
absolutely.
happened.
Yeah,
that's an important thing.
So.
Rick, I appreciate you all the time. Thanks for coming in.
Thanks for having me, Scott.
You bet. Good information, and we'll keep in touch with you.
Okay, sounds good.
All right.
Thank
My
you.
guest, Rick Quevedo from Desert View Family Counseling here on KSJE. Back with more in just a moment. The time right now is coming up on 8:55. This is KSJE.